State media in China played down the severity of its surge of COVID-19 infections ahead of an expected briefing on Tuesday by its scientists to the World Health Organization, which is hoping for detailed data on the evolution of the virus. China's abrupt U-turn on COVID controls on December 7th, as well as the accuracy of its case and mortality data, have come under increasing scrutiny at home and abroad and prompted some countries to impose travel curbs. The policy shift followed protests over the zero-COVID approach championed by Xi Jinping, marking the strongest show of public defiance in his decade-old presidency and coinciding with the slowest growth in China in nearly half a century. As the virus spreads unchecked, funeral parlors have reported a spike in demand for their services, and international health experts predict at least 1 million deaths in the world's most populous country this year. China reported 3 new COVID deaths for Monday, taking its official death toll since the pandemic began to 5,253. On Tuesday, the People's Daily, the Communist Party's official newspaper, cited Chinese experts as saying the illness caused by the virus was relatively mild for most people. Severe and critical illnesses account for 3% to 4% of infected patients currently admitted to designated hospitals in Beijing, Tong Jiahui, vice president of the Beijing Chaoyang Hospital, told the newspaper.